Hey guys, ECRG here, back with another episode. Today we're going to talk about why sites should use central binders. Now, first we're going to ask, what are central binders? And binders are, first of all, they're talking about ISF binders. These are for the investigator site file binders, and this is going to house everything from GCP training, all the trainings that the site are going to use. GCP training, maybe it's city training. They're going to house CVs, medical licenses, FDA 1572s, financial disclosure forms, investigator brochures, the protocol signature pages, and I can go on and on and on. The ISF binder is going to hold all of those things. And so a lot of times when CROs or sponsors are developing these binders and they send them to the site, they have little folder dividers for each of these sections. Well, if a site is doing 5 studies, they don't need to print out 5 separate CVs because the CV is going to be the same for the 5 separate CVs for the PI and have that one in each binder. They don't need to print out 5-6 different GCPs for each study site staff member just to put in the different binders. So what I like to have my sites do and recommend my sites to do is have a centralized binder where they have the stuff that they're going to use between studies in that binder. So one of the easy ones to do is GCP training. They're going to need an updated GCP training for every study that they're conducting. So that's something that you could put in the centralized binder for the PI, all of the sub-Is, basically everyone on the delegation log is going to need GCP training. So that's something you hold centrally in a centralized binder. If you want to get fancy, you can put it on a centralized drive on your computer, but that needs to be made accessible to the monitor. That needs to be made either accessible when the monitor comes on site. It needs to be divided just like an ISF binder and held in a secure place. But I recommend an actual 3-ring binder because some sites, some sponsors will not accept electronic. They will not accept an electronic form of this ISF binder. So they want an actual 3D ring binder. This is something, if you are a site owner or if you're a study coordinator, I would enact immediately because it's going to save you a lot of time and stress and a lot of updating that you won't have to do in each of your binders. Because every time someone on the site staff gets a new CV, gets an updated CV, then you've got to print it out 5 times and put it in all of your binders. Whereas if you have a central binder, you put it in that one central binder. And then you just give that binder to all of your monitors, and then they can look at all of the stuff that's the same among your studies. So things that could go in there are things like your CV. Everyone is going to require a CV, usually updated within about 2 years in that binder. A medical license for your PI and your sub-I. Put the medical licenses in there. And the centralized binder does not have to be just for one sponsor. You can put this in there literally for the entire site. There can be other people's CVs and stuff. Just have the monitor go through there. Or maybe have each CV labeled for the protocol if there's a bunch. But most of the times I've seen it and it's fine without labeling and being specific about which one. Because typically, one site doesn't have 20 PIs or something like that. So you can put, CV, medical license, GCP training in there, or any type of other training that that someone on the site staff may have. If you got a nurse practitioner or something like that, you could put that kind of license in there also. So he said CV, medical license, GCP training. I think that's about it centrally. Other stuff, the protocol training is going to be specific, so you'd put that into the specific ISF binder. But the stuff that is going to be used between, you definitely want to put that in a central binder, and that's what I'd strongly recommend. It's going to save you a lot of time, effort, and energy. So if you have any questions, email me at eliteclinicalgroup@gmail.com. As you guys know, we'll always have the resume review program. It's incredibly popular, so email me if you're interested in having your resume reviewed. We've got a few different options going on right now, from the most basic to the most elite of options, depending on what you're looking for. A lot of people are interested in your resume review program, so I would email now so you can go ahead and get on the list to have your resume reviewed. So once again, that's eliteclinicalgroup@gmail.com. Take care.